Ambassador Brandt, I'm very honored to have the opportunity to speak with you today about an issue that is very important for the Peacebuilding Support Office, that is very important for the Peacebuilding Fund, but that I also know is a priority of the Dutch government. So I wanted to start by asking you, why do you think mental health and psychosocial support is so important for peace building, but also why is this so important to the Dutch government?
As I always said, it is mental health and psychosocial support is critical simply because we cannot build peace on broken minds.
Mm.
And I think that was also a little bit the starting point for the Dutch government. We felt that this is such an overlooked issue, both when we talk about our development, humanitarian and peace building efforts. And it's absolutely critical if we want to move forward on basically all three of these angles.
And the work that you have done until now, what would be the best way to integrate mental health and psychosocial support in peace building strategies? What would be, I would say, your recommendation of how to integrate this better?
I think one of the ways to better integrate that is to start again, with the people, to better understand what the people's needs are, and to see how we can actually work on these stigmas. And for that, again, I think it's crucially important that we also work with local organizations, that understand the context and the specific situation that people are in. I think secondly, at another level, mental health and psychosocial issues do not have like a logical home. It is it's a different field of work. It requires bringing together different fields of expertise, and as I said, it's relevant to humanitarian development and peace building context. So if we want to address that, we really need to treat it as the horizontal issue that it is. So basically also bring the UN system in this case together to make sure that we address it from all different angles.
I really think that naming the issue and having a conversation on it, as you're saying, is really an important start. And certainly when we did the mapping and we started asking questions, people said, "Oh, yes, yes, we do this, but we call it something else." Yeah.
You mentioned, of course, the work that the Peacebuilding Fund is already doing, and I think absolutely we're very happy with that. And some great work is already happening. For instance, also in Somalia, where with Peacebuilding Fund support, WHO, UNICEF, and IOM are working together to provide access to youth-friendly mental health care and community-based psychosocial activities and services. So we'd really like to see more of that, different organizations coming together around the issue. And I think also the Gender and Youth Promotion Initiative, again, provides a unique opportunity to further advance this idea of how we do MHPSS in peace building. And well, I hope that many organizations will see that there is an opportunity there and come up, with inspiring new ideas and proposals, so that it can be a real platform to, move this work forward in the areas that we work in.